It's a good morning to you. Welcome to Asakhe Online. My name is Zenzele Ndebele, and this is the Breakfast Club. Once again, we bring this program to you live from Thorngrove Hospital. But I'd like to say I'm very happy, delighted, amazed, because there is a huge difference from the last time we were here. The last time we were here, which is less than a month ago, this road or this place was not tarred. The buildings here were not as they look now. Now there is a lot of activity, there is construction, there is life that is going on. I would like to say thank you, Zimbabwe. Thank you, Bulawayo, for the overwhelming support that you have shown in the last months. Every week, donations are coming in left, right, and center. People trying to help where they can, and this is commendable. I think if there's one thing that we have learned from this COVID pandemic is that if we are united, if we are working as one, we can achieve a lot. And today we are at this place once again to receive donations from a number of organizations. And one of the people who were donating here was Ezra Spanda, the Ezra Spanda initiative represented by Dr. Soloayo Ngwenya. He donated gloves, gowns, goggles, and there was also mentioned that Ezra Spanda has managed to collect about 14,000 US dollars that will be used to buy equipment, and we understand that the beds that are being fixed or being sorted, that will be donated to hospital. Babu Spanda siyabonga siyabonga tawu inkosi belawe banengi njalo abanye abadonatayo lapha bekule Chicken Inn who were donating ama sanitizers. There was a lady, I think her name is Shirley. She was donating clothes to the old people's home. Over the week we have also had a number of people who are donating. We have had companies who are donating boreholes, geysers, paint, solar panels, and a lot of other things. So this is what we were here for, to get the donations.
Ezra Spanda, I've known him since the 80s, when he was a boy, we were boys. So the friendship has not died for more than 30 years. So he asked me to come and represent him here today because he's stuck in the UK and he cannot travel because of coronavirus. But he's also touched by this impending crisis which we are going to face very soon in the winter. So he saw it fit that he contributes towards the fight against this coronavirus, which we are going to face soon. So I will say what he has donated here. There are 400 surgical masks and 400 N95 masks and 50 disposable gowns and 30 space suits, specialized suits, and 10 boxes of gloves and 5 monitors and 20 goggles. And he also wants me to mention a few people who contributed here, so I will read his message on his behalf here on the phone that he sent me. He says in his initiative in the diaspora, he's worked with other people and they've raised 14,000 US dollars to buy hospital equipment for Thorngrove Hospital. And he's working closely with his niece, as a musician called Sisa Senkosi Mkandla, and a man called Kobo Maisa. And there are other hundreds of people who donated through the crowdfunding. They want to specifically thank the Zion Church of England, led by Pastor Zondo, who donated 1,375 pounds, which is almost 1-to-1 to the US dollar. And Sima Mbeni Women's Group in the UK, represented by Faith Malinga, which donated 1,000 pounds. And the over 40 confident women of Zimbabwe and Southern Africa, which donated 270 pounds, and many other individuals. And he says currently they are waiting for 20 beds that are being made by the manufacturers. And once these are made, they will be delivered here to Thorngrove. And he has a passion for the people here. He says that I should hand over this on his behalf, and he would like to thank all those people who have contributed predicament here, and then the need that we need to look together, work together, and come together and hand over this donation.
We are here to donate sanitizers, 50 of them, 50 by 5 liters, and dishwashers, which are 84 by 2 liters, and 50 loaves of bread, bakers in nice loaves. As Chicken Football Club, we are also touched by the pandemic that has wreaked havoc in the whole world, Zimbabwe included. We found it therefore necessary as a club to join the nation in this fight against the pandemic. We are hopeful that if we join hands like we are doing, we will win this battle against this disease. We obviously live in the communities that are affected. We are also affected one way or the other, hence us coming to donate so that we contribute in this fight.
Jonas sizwile umkhuhlane lo okhona kuthiwa ufuna kakhulu abantu asebekhulile ngokuthi immunity yethu nxa sesikhulile la iba phansi. So mina ngizibuzile ukuthi pho ngizakwenzani njengoba ngingumntwana walapha koBulawayo. Ngase ngikhumbula ukuthi silezinye impahla ezinengi esizingasazisebenzisiyo and lokho ezisanda omama labogogo sebachona. Kanti pho njona silabogogo abanengi lapha koBulawayo kungani ukuthi sibaphe izinto lezi ezaziphiwa omama besaphila. So mina ngase ngibuthelela ke izigqoko zami ezinye ezabantwana ezinye ezivela ngaphi ezinhle sibili. Asikho ukuthi ogogo seyophonga ubalahlela izinto ezidabukileyo. Izigqoko ezinhle ukuthi njobani umqando usuzabuya labo gogo bagqoke kuphumuleni. Ngiqale ngekuphumuleni not for any reason but ngizwa kuthiwa kule ntembeni, so ngizabuyela futhi ngedinga ezentembeni. So ke mina donation le is on my personal capacity njengomntwana wakoBulawayo.
Masizwe isikhathi senhlungu oyenesh ake ngikhulume nesizwe phela ngikhumbule ekhaya bo phela ngikhumbula uBulawayo phela ngikhumbule ekhaya bo
The COVID-19 pandemic has challenged our society on how to interact and engage each other. Ladies and gentlemen, the world as we have previously known it is going through a crisis and transition. And during this period of lockdown, let us reflect, realign and refocus our energies and strengths on redefining the future of Bulawayo. The last few months have eclipsed the city and we have learned a lot of lessons from this pandemic, and that we can only do better or survive by rehabilitating what we have here than looking even beyond our borders for health facilities. So I think this explains why even those in the diaspora are putting a lot of resources in the country so that our health institutions reflect what we all need and what we require for the purpose of fighting even future pandemics as they come. While the pandemic has brought about a lot of uncertainty to the economic and social sector, let us continue to search for innovations and processes that will allow us to rise above the tide. I have great confidence on the teams that are working day and night to ensure that we tackle this scourge. I applaud the technical teams who are serving diligently to ensure that our responsiveness is robust and effective. Ladies and gentlemen, the importance of risk communication is critical if you are to fight this pandemic. successful. Our teams continue to empower the community with information on the disease so that we reduce the rate of infection and subsequent deaths. This period of limited movement has also served to curtail the spread of the virus, and I urge each one of us to continue with this culture of hand washing and physical distancing. In addition, the City Council is working on decongestion of central business district. To this end, wholesale distribution centers of fresh produce markets will be decentralized to the suburban areas so that over and so that beyond this pandemic, we are able to contain even other future communicable diseases. It is imperative that as a nation and city, we continue to reduce the number of deaths from the pandemic. I am therefore grateful for the collaboration that we have witnessed from various partners and sectors and even from government itself. Mama Honorable Minister, we thank you for your presence here. It is testimony that as Bulawayo, we are working together to contain this pandemic. Ladies and gentlemen, we are grateful for your generosity. The donors, Chicken Inn Football Club, Ezra's Initiative, and Mama Shelley. We are grateful for the generosity that we have shown. Abanye nowadays, because of this uncertainty, they are now saying, but it's not easy during this uncertainty to keep towards the good of the public. So we want to applaud and thank everyone who has come on board to assist us. Danish Aid, we have heard that they are working with the city in terms of risk communication in absentia. Allow me to thank them for what they've done for the city, even before and beyond COVID. So we want to thank all who have come here. On behalf of the city of Bulawayo, we are humbled by the donations that continue to come. Our members of parliament, we are aware that risk communication cannot only be left to the city. You have a constituency that you represent. In fact, you represent Bulawayo, and if we leave it only for Bulawayo City Council to communicate the risk, to the people that you represent. So we thank you for coming here, and we wish that it's not the first and last that you are coming to be with us as we receive these donations and as we gather together to find solutions to this pandemic.
So we got an opportunity to interact with the officials of the city or the city fathers and mothers. So the governor or the resident minister of Bulawayo, Judith Ncube, gave us a press conference where she was explaining to us some of the measures that have been put in place to try and combat COVID.
As you are all aware, COVID-19 has called on all of us to exercise a high level of hygiene by frequent washing of hands, using soap and running water. It is our responsibility to provide water at all times to ensure residents have the resource at their disposal. The city continues to be affected by water supply challenges. As at Tuesday, 28 April 2020, the city's water supply dams are at 31.07%, with 2 dams still decommissioned and Lower Ncema earmarked for decommissioning in May 2020. The province has been affected by perennial water shortages over the years, coupled with growing city demand. I am therefore pleased to announce that government has allocated ZINWA $10.6 million for rehabilitation of the Nyamandlovu boreholes. This will lead to the rehabilitation of 15 boreholes that will increase quantities from an average of 3 megaliters per day to 8 megaliters per day. We note that This will increase the raw water being received in the city. We are advised that there is consideration for the completion of Epping Forest project and other proposed initiatives. As I speak, 5 boreholes have already been sited in Lopengula Extension, Old Makwekwe, Makwekwe West, Pelandaba, Pumula South, and Kulumane. Let us continue to preserve the limited water we have as we await the rainy season. In addition, our City Council recently introduced a 120-hour water shedding schedule to stretch the current available water supplies. You are aware the better part of the national lockdown has been characterized by large crowds of people at our markets in the Central Business District, CBD, and at retail outlets across Bulawayo, intending to buy vegetables and meal, respectively. This did not augur well with the guidelines of the lockdown order, and definitely provided the hotbed for coronavirus to spread. Furthermore, the novel COVID-19 pandemic has necessitated that countries relook the way business is done. The province is therefore putting in place systems that will be compliant to World Health Organization protocols. The following measures are now being implemented. 5th Avenue, stretching from Robert Mugabe to Lopengula Streets, is being closed off permanently to any form of trading, and henceforth the closed street will be reopened as a public road in terms of the Roads and Traffic Acts. All the informal traders that were operating along 5th Avenue are relocated to their respective suburban shopping areas, informed by the existing City of Bulawayo vendors database. The Kotama Weekend Flea Market, currently occupying 8th Avenue, bounded by Josiah Tongogara and Robert Mugabe, is closed off immediately, and the services of selling second-hand clothes also be decentralized to suburban shopping centers. The Lopengula Vendors Mall is being redesigned to meet the required standards. The establishment of wholesale markets creates an opportunity for public-private partnerships, and this is being pursued vigorously to ensure that deliveries are convenient to the public and done in these decentralized facilities. In the same vein, we have come up with a meal distribution strategy that will see meal being delivered at household level. We have selected 3 priority areas, namely Thorngrove, Ncube, and Ntumbane. Thereafter, the program will be rolled out to other locations in both high and low density suburbs. We are working in conjunction with the Grain Millers Association of Zimbabwe for the smooth execution of this strategy. Finally, we would like to assure you that testing of COVID-19 will soon be done at all major hospitals in the province. Rapid response teams have been set up at Mpilo and United Bulawayo hospitals, bringing to 7 all the RRTs in Bulawayo. This should see scaling up of testing and will result in more people being tested for COVID-19. Eventually, testing should be done at all clinics. We continue to urge all residents to stay at home. Wash hands frequently with soap under running water. Exercise social distancing and contact our call center when you suspect you have COVID-19. Together, we'll win the battle against this pandemic. I thank you. The city of Bulawayo is guided by its residents. If the residents put across a request or a recommendation to the city of Bulawayo, there is no reason why the city of Bulawayo can fail to make that recommendation known to the higher level. So, hence we are here to say we have put in place some measures. We are responding to that.
Yesterday, go hyper. Ngithole amapolisa emisa abantu beba checker incwadi zabo. Apparently in Tembala ku B1800 already there were around 8 abantu akade sebebanjiwe because they are not supposed to be at town. And bese ngabala abanye kade bengu7 kade befanele bengene emoteni. Ngaza identify elinye iphosa lapho salanchaya. Lucky lo mkhulu wabakade ngusayijeni wasebuya. Angazi ungazile wangiqamba wathi Ncube buyeceleni ngathi into eliyenzayo le li right nxa lisenza umsebenzi. But what you are doing now, lithatha abantu already sokulabantu abangu7 lina lingu8. Lifuna ufaka abanye abangu8 emoteni. I-social distancing liyana nxa libabopha what is going on. Bahle basuka bachiya labana kade sebebotshiwe bahle babachiya khona apho bona bayiqela emoteni. Unfortunately camera yami ibikhatshana ukuthi ngilinike evidence. But it's happening all over. U-Abednego umfowethu Ncube wathi ezinye izinto siripote kibo. But by the time sisiya-reporte ofisini ka-Abednego kuyabe sekwenzakele phandle abalaleli. Laba ama-lower rank abalaleli phandle ngale ngoba abakwenzayo lingasinceda njani ngokuthi nxa abantu bebotshwa asithi ukuthi abantu abagangi. But ngendlela abayenzwa ngayo bafaka ku B1800 bona amapolisa mbe babe ngu20 ku B1800 yankhona abayenza social distance.
Siyabonga i-observation naleyo lokubona okwenzakalayo. It is our duty, all of us. Masibona into etshelileyo. Let's talk about it. Asihambisene ema-ofisini. Mina usungitshelile sengisiyahlala phansi lo mkhulu wamapolisa ngimbonise because labo ngabantu, they are human beings. Uma sisithi social distancing labo kumele bekunanzelele. Akutsho ukuthi nxa ungumpolisa usoze ube affected. La ungaba affected. Sonke kumele sikunanzelele. Let me tell you of something. Izakhamizi ezithile zibuyile kimi zazi ukuthi hayi mama. Nxa sigada amabhasi siyehlika. Labantu abalama 65 and above singehlika. If you give an example ngeLuveve Road, wehlika eMakhandeni uzokwehlika eMachobani uzokwehlika eMakhetheni. Can't we do something? Ngababuza athi what are you suggesting? Ngoba sifuna ukwakha sonke sifuna ukwakha uBulawayo, sifuna ukwakha iZimbabwe. And banginika ukuthi besicela abantu abadala bengehliswe ebhasini. Akungena umpolisa athi verify behleza abantu abadala yehlisa nabantwana. And when we discussed about it, the Silejok members sonke savumelana ukuthi bekuyi oversight. That's a good suggestion. Yikho kwakhe sikufuna ukuthi singeneni kiko kube yiculture yethu eyokuncedisana ukuze senzeni into yethu sibuke ekugcineni.
Okokuqala bengithanda ukwazi ukuthi mama yebo lisitholele imali yokuthi kulungiswe amabholo ngapha eNyamandlovu. Sesikhathele ngoba lokho sithenjiswa ngezambezi water. Selike lakhuluma la yini umongameli labezini abalitshela ukuthi kubuyani. umbuzo wami wesibili uya kumeya wedolobha ukuthi sicela lisitshele ukuthi kuhamba njani lapha esibhedlela. Siyabona kuyakhiwa kuyalungiswa. Isibhedlela ngalo kugcinwa khona abantu abangabanjwa yi-COVID-19 sesilungele yini? Njalo mama ngapha ngiyakhala futhi yini ukuthi awukacaci ukuthi izibhedlela sezilungele yini ukugcina abantu be-COVID. Abantu lokho kuthiwa bahambe behlala ngikhaya kodwa nxa befika ngikhaya bafika bethelela abanye. Okunye futhi abantu bayasuswa ku-quarantine isikhathi singafiki. Nxa selisehlisa selisithi 7 days, aliboni ukuthi selisephula imithetho ye-WHO? Ngiyabonga.
Mayelana ngeZambezi water project, ngiyafisa njani ukuthi like liyofika liyobona idamu bakithi. There is a lot that has been done. There is a lot that is happening. Lingazuza ithuba sicela likhave ama-achievements ethu ukuze sizigajeni ngokuthi at least there is something eyenzakalayo. Ngiyafisa ukuthi like liyofika libone ukuze likhanyise abantu bakwazi ukuthi kuyini okwenzakalayo. Phoso sokusele ukuthi kube i-pipeline but idamu hayi kulomsebenzi omuhle kakhulu osuyenziwe. Ngivumela ngiphendule ukhulume la ngemadlanyana le efakiweyo. Sifisa ukuthi sikhulumeni sisenza with your support and my support, his support, her support, and everyone's support, we will be able to make it. Mayelana wothi mphendule mbijana ngesibhedlela ubaba uza kutsho. Ekusileni liyakwazi ukuthi sihlala isikhathi eside. Equipment kumele idingwe. And we really appreciate our well wishers. They've done a sterling job. Kumele sithi kibo siyabonga. There is a lot that is happening. Sithanda ukuthi sithi thina okwakhathesi yebo ye kungaba le equipment engakafiki la eyemele yenze isibhedlela siqala ukusebenza. I'm sure you are aware ukuthi i-lockdown le i-affecte lama borders ethu. But uhulumende usedinga indlela zokuncedisa labo asebesidingele izinto ezijiyeneyo across the borders. Kungalungiswa impahla lezo ziyangena ukuze isibhedlela sethu ngale kusileni sisebenze. I-Thorngrove ngabona liyananzelela thina on behalf of government vele kangiboni Thorngrove, angibone kusileni. Ngifuna izibhedlela ze-province yakoBulawayo zonke zilungele ukwelapha abantu. Kumele umuntu kumbugula i-COVID-19 yena lesatshwe ehlabe umhlaba wonke kumbugulani. Izibhedlela zethu azibe ready. Zenelise ukugama zelaphe abantu ababe belemkhuhlane echiyeneyo. But a lot is being done. I want to say thank you so much to the government. Thank you so much to our local authority. Together we are moving with the speed. Singazuza sibili support epheleleyo. Singaba lama results amaningi. The town clerk told us in our meeting enxusa ukuthi izakhamizi kungani inkosi ingaziphathisa izakhamizi zethu zibhadale ama-revenue holes ethu akhamisile. Sicela abantu beyobhadala ukwenzela ukuthi vele singakhuthisi ukubhadala omongikazi bethu, ngoba singakhuthisa kuza sifake enkingeni. sicela uZulu kaBulawayo siyobhadala ngobunengi bethu behamba abantu beyobhadala ukuze kuzuzakala izimadlanyana zethu senelisa ukubhadala omongikazi bethu lezi sebenzi zonke eziku-essential services.
7 days quarantine lesikhitshiwe libona ukuthi sephula imithetho yeholo.
Ngabona singahlanganisa engxenye kungasiphica baba dokotela. Ngicela wena usirespondele kulowo mbuzo.
Kuvunyelwe ke ukuthi uyitshintshe ihambelane lesimo sakho. Ngeke kuthiwe gqoka izigqoko zokuya ku snow wena kungela snow kini. Kumbe yenza into vele ungeke wayenelisa ngenxa ukuthi imali yakho kayifuni. Yikho ke thina sithe sesibukhangela lapha eZimbabwe iministry yethu yasibona ukuthi nxa abantu bangangena ko quarantine for 8 days ungavele ungene ulomkhuhlane uthe ungenwa ulomkhuhlane within 7 days uyabe usukwanisa ukubonakala ukuthi positive kumbe unegative. Lo negative singamtesta ku day 8 sesibona ukuthi vele kala umkhuhlane sesimdischarge ozatholakala lo mkhuhlane sesimgcina insuku ezinde siqhubeke siya phambili simgcinile ku isolation. Ayisikho ukuthi uhle akhutshwe in 7 days wonke umuntu apho kuvulelwa nje ukuthi 7 days ichayile sevulelwa. I21 days lana ngeyokuthi lalo ongene lo mkhuhlane lanxa engelatshwanga kumele abe sesile nxa engakasili uyabe engasekho infectious engasenelisa ukuthelela abanye umkhuhlane. Lapha uyakwazi ukuthi asoze siteste lanxa singabatestanga in 21 days baphuma nje sebe safe. Kodwa in 7 days kumele bakhutshwe ngetest emnyango ubonakala ukuthi iPCR futhi.
Singena laphana egedini sibonile lapha okuthiwa isilungu ipath ukuthi izimoto nxa zingena lapha kumele zigeze ama infections ezabe zilawo ziwachiye kwapha nxa seziphuma. Siyabona lapha uphahla nxa ungakhangela ngapha kuyatshengisa ukuthi uphahla belunjani usolunjani ngapha sokulungisiwe. Imigwaqo siyabona ukuthi ibinjani namhlanje themba sananzela ukuthi kuyasetshenzwa ukhona okwenzakalayo ngale kwa solution center. Sibona umgwaqo olungiswayo ngale uqonda straight khona ngale siubonile. Dokotela okunye ungasiphendulela in terms of ukuthi kuma wards kwenzakalani in terms of specifications afunakalayo for purpose of containment of COVID-19.
Nxa bengena esingathi khona yi-donning and doffing ukuthi nxa usugqoka izinto zakhona bagqoke kuhle ziyaqheliswa kuphinde kubonakala ukuthi kuzafakwa i-oxygen i-piped oxygen kufakwe lamagiza sizwile ukuthi adonethiwe izolo kuze kube lamanzi achisayo. Ngale kwakhona le mortuary yethu izawusetshenzwa le building emhlophe lapha sizabona ukuthi layo sokusiyaphutsha layo kuzaba lendlela yokuthi i-renovate ukuthi isebenze nxa sithe saba lomnyama kwaba lomuntu oswelekayo ekhona ngale. Kodwa sizamgcina okungaphansi kwamahola angama24 i-24 hours ngoba kumele ahlangcwatshwe masinyane nxa efe nge-COVID kumbe ngomkhuhlane o-infectious. Kule i-building le esithi yi-C-ward children's ward lapha kuzakhangelwa uphahla kakhulu lama-floors kuze avume ukugeziseka. Kuphinde ekucineni kwama-wings woyi-2 lawa kuzaba lama-bathrooms kumbe i-ablution block lenye i-ablution block ngale kwakhona. Kuleyi i-building engemva kwami leyi layo ama-floors akhona azatha ukukhangelwa nxa imali isekhona alungiswe njalo. Laphana kule point okuzakhejwa khona imgodi bese kufakwa i-jojo tank lapha i-donation yakhona isiyenziwe isite yomgodi lana enye point lapha sacela ukuthi abantu bangayikhahleli nxa behamba lapha.
And one of the topical issues is the issue of moving vendors from town in other areas like 5th Avenue, closing of Kotama, a tower block. So there were questions that were being asked how these people are going to be accommodated, and the director of City Council managed to give a brief explanation of how these vendors are going to be accommodated.
Kuqanje indawo ezimbili okuzakhitshwa khona ama-traders. One such place i-Tower Block okade kule weekend vendors. Leyana layo it has been abolished. Abanengi bama-traders ababuya laphana nge-weekend ngabantu abasuka kuma-flea markets ase-town. So ayisikho ukuthi iningi labo abalandawo zokuthengisela. Balazi indawo zokuthengisela, save that i-Tower Block was lucrative because of our numbers and the crowd that it was generating. Kube sokusiba vibrant and a thriving place. Ngaphandle kwalokho kule ndawo esezibe identified other than kuma suburban areas. Lizananzelela ukuthi silendawo esilungisileyo ese-Highlanders eceleni kwe-Highlanders Football Club. That place has been paved, ama-toilets alungiswa, kule potable water, which are the requirements that are required in response to i-COVID pandemic. So kulama-traders esiza accommodate khona phana e-Highlanders place. Kukanti it was mentioned ukuthi labo abaku Lobhengula Street labana abasuswa, kodwa kuzayenzakala laphana ukuthi kuzaba le replanning to respond to the requirements as a COVID ukuthi abantu be trade be safe. So they will be spaced accordingly so that abantu abathengisayo bebe safe, labantu abazothenga bebe safe, kungabi le congestion. Nxa sesibuya ke emalokitshini, ama-shopping centers ethu wonke koBulawayo asema-western suburbs as well as ema-eastern suburbs alezindawo that have been planned and designated for vending purposes, ukwenzela ukuthi ama-vegetables izakhamizi ziwathole duze lalapha abahlala khona. Sinanzelele ukuthi bekule unnecessary movement, abantu besuke ekuseni beseyabuthana edorobheni beseyathenga amatamatisi bebuyela futhi ezindlini at great cost to them and at a great inconvenience to them. So i-COVID le isipha an opportunity to relook at ama operations ethu with a view ukuthi senze ukusebenza kwabantu kube lula, senze abantu bengabuthani, beriske impilo zabo, beriske lempilo zabantu abazothenga. So emalokitshini we are going to be allocating ama vending areas kuma shopping centers wonke. Kulabantu abangu 604 that were trading ku 50th Avenue that are affected. We know them. We will give them ama trading spaces closest to their places of residence. Linked to this move, ngama food distribution hubs, whereby imoto zama vegetables ekuseni, we are talking to them. The expectation is that sizaba director to ama approved food distribution hubs. At least 5 have been identified and aku situation yokuthi lanina ngaqala ukusebenza. Ese Old Phumula ivele isisebenza. It's a new facility i-council commissionileyo 2 years ago. So ngangale deliveries are already being made. In terms of strategic location, sikhangelele ukuthi emganwini kube le ndawo enjalo lapho izimota ezile ma-vegetables zizahamba ziyedelivela mkhona ngangale. We've identified a partner there esingasebenza laye. Ngokunjalo eChabalala kule ndawo esesiyi-identifyile eyayivele iyi-market. Eyinye ise Nyamandlovu sile market place laphana layo ezahlisebenze. The same with the Magwegwe North, we have a facility there. The same with the Ntumbane. Ezinye izindawo sisazisebenza okokuthi iviki le isiyaphela kumele sibe sesiyenze progress in that regard. Ngamafitshane yikho kwenzakalayo lokho nge-decentralization of ama-vending activities. Labe bebevele bethengisa emalokitshini, labo they will be incorporated. But umehluko ukuthi kuyamele bonke bebe licensed accordingly, bephiwe ama-vending places abo belandele umthetho wako Bulawayo. Abanengi bebezithengisela nje mahlayana, kodwa kwakhathesi sizabalanda sikhulumisane labo sibenze bethengise okusemthethweni ngokuthi belandele umthetho kaBulawayo.
A lot was going on. I hope you're going to listen to this program, learn something, appreciate the work that was being done by various people. And you still have a chance also to donate. I think this place needs to be green. We need a lot of things around. But let me say once again, thank you, Zimbabwe. Thank you, Bulawayo, for coming together for the various donations that are happening at this place, because the place looks, wow, it's looking different. There's progress, and we hope this will continue. From me, Zenzele Ndebele. Have a good day.